All right, everyone. Greetings. This is Eric Glazer, and you have logged in and dialed into the Population Health Executive Roundtable. Bear with me for a moment. I got to click a
All
couple
right,
of crucial
everyone.
buttons. There we go. That's my YouTube live stream that always disrupts us in the very beginning. Uh, Today's topic, very exciting. It is how to communicate and market to healthcare during the COVID-19 crisis. This is a first of its kind topic that we are covering, and you're about to meet four experts who will be offering their insights and experiences to all of you in the hope that you could take their ideas back to your organization. We produce these sessions to highlight great ideas or bright spots in healthcare. If you are a regular, I know they will tell you, if you're new to us, that this is typical, your typical webinar or panel. We spend a lot of time focusing on identifying cool initiatives and cool ideas, new ideas that hopefully are applicable at your organization, depending on the topic. So that could be, in my opinion, the most cost-effective way of improving healthcare in our lifetime, and it's one of the reasons I decided to start this roundtable series. We've been running this since 2014. This is the first time we've tackled a commercial topic. Typically, we cover topics oriented to patient or physician engagement, behavioral health, social determinants of health, or even value-based contracting. We're covering this topic based upon a lot of your feedback. Many of you wanted us to cover a topic like this, and we got that feedback in large part from our surveys we sent to you. We send out a feedback form at the end of every single one of our roundtables, and we ask you the favor of taking 2 minutes to fill out the mostly multiple choice feedback form so we could plan our programming to best benefit you. We never take it lightly that you're spending 60 minutes of a busy day, especially during the current times, to log in and view our programming. So we want to make sure we're delivering each and every time for you. And that's why it's so important. And while we take the NAG approach that you fill out our feedback form. So you'll get that around 45 minutes past the hour. It'll be sitting in your inbox. While maybe you're watching the end of our session, we ask you the favor of completing it so we know where to go with future programming. So I thank you in advance for that. If you are joining us for the very first time, Shared Purpose Connect is the producer of this, the Population Health Executive Roundtable, as well as the Bright Spots in Healthcare podcast. We typically produce programming for the provider and payer markets to enable leaders at those organizations to share ideas and network with each other. We also allow specialized healthcare vendors who are sponsoring our programming to sit on the panel as well and showcase their subject matter expertise and produce novel content and help with their lead generation. This is a little bit of a different format for us, and I'm excited to introduce you to what I think is like an all-star panel here with really deep expertise in certain areas of marketing and content creation. And so with that, I'd like to briefly introduce them to you. You might have Sherry Keels, our producer who's working behind the scenes for us, will be sending you a link to their bios, I believe. So you could read about them. You might have received an email this morning with their bios as well. In brief, we have John Stock, who's the former Chief Executive Officer at World Healthcare Congress, a meeting many of you might have attended in the past. He's an expert in direct and B2B marketing. We have Jeff Green, formerly with great brands like Zipcar, Upromise, Boston Scientific, big in the robotics industry as well. He's our content marketing and social media guru. We have Patrick Streck, our token buyer here. Patrick leads IT strategy for Bay State Health in Springfield and is also the president of their commercial arm, Baytech IT. So he'll be able to give you multiple perspectives on some of the interesting and innovative ideas we'll be discussing with you today. And we have Mike Carlin, who's the owner and CEO of Vertigo Partners, and they specialize in client insights and market research for large companies. He's also a part-time stand-up comedian. I don't know if we'll benefit from his talents today, but we're excited to have all four of you on the call with us. So I want to, Mike, let's start with you. And I have two screens here, folks. I'm going to look at, oh, that's something else. So I have a Q&A module to my right. If you hover over your Zoom screen, in most applications, Mac or PC, I think the Q&A module will sit at the bottom of your screen. If you want to submit questions as we go, Sherry and I will be on the lookout for the Q&A module here, and I'll be able to integrate those questions live into our discussion as appropriate. We ask you the favor, this is important, to use the Q&A module, not the chat. The chat gets very disorganized. I'm able to manage the queue much more effectively by looking at the Q&A module, which is right over here. All right, there we go. All right. So Mike, let's talk about how in this pandemic should organizations be rethinking their marketing strategy? You know, how do you determine the appropriate communication approach right now?
Well, thank you, Eric, for that. I just want to give a brief overview of what it is I do, because I think it is unique to what everyone else does in terms of the panel. But Vertigo is basically a custom market research and insights agency. We focus primarily on what I call high-touch qualitative research, and we work with some of the biggest brands to basically help them have conversations with their own customers, you know, with their own consumers. And then we take those conversations, we translate them to insights that they could use for decision making. So, you know, for example, let's say a pharmaceutical company wanted to, you know, understand the experience that a Crohn's patient has on a website, educating people on Crohn's disease. Well, they'd hire us to do that, to recruit those people and to watch them have those experiences. So I just wanted to provide that as a quick overview. But to answer your question about marketing strategy, ours, and this ties into my advice in a minute, but you know, our strategy has always been to nurture existing relationships and grow organically. And when I think about the ways in which we nurture those relationships now, they've changed drastically. Like the desire to nurture the relationship remains, but how we do it has changed, tremendously. I can't take people out to lunch anymore, or people out to dinner anymore, or do lunch and learns, things like that. And conferences aren't happening, right? So that's where I would get most of my net new business, is through personal networking. And I suspect a lot of people who are listening in to this webinar are in the same boat. If you're a healthcare, technology company or health technology company, you can't just go into a CMIO's office or a CTO's office and talk about your solution. I mean, those meetings just aren't happening. So what do you do? What do you do in that situation? So I recommend, at this time, kind of taking a step back and thinking about all the different decision makers, in your world, and kind of putting them into different buckets and segmenting them, almost drafting personas for them, and then sketching out different experiences and messages that you might think would resonate with those different personas. And that comes out of a design thinking exercise. And this kind of reminds me of a project that I did for a payer a few years ago, where we were actually asked to segment their individual healthcare market. And we identified through our segmentation process 6 unique segments based on both demographics as well as attitudes towards health and wellness. And in doing that, we were able to go back to that client and say, okay, well, these are the different segments, and this is how you can reach them, and these are the messages that you can reach them with. So I guess what I'm saying here is that you can take that own approach. I mean, I do it for research purposes, but you can take that own approach for your own customer base, kind of segmenting them out, developing personas, and then figuring out, how you best can reach them in this age where, we can't be in person anymore.
Eric, you're muted.
Been doing this for 6 years, and ultimately once a show, I always forget to take myself off. So, Pat, why don't you put on your buyer hat on, and how would you advise our audience to be rethinking their marketing strategy? If you could sort of expand upon what Mike was saying and take us into sort of what it's like to be bombarded by all kinds of vendors trying to get in.
So bombarded, inundated, and otherwise totally overwhelmed. I can tell you, having come from the opposite side of the table, and ever since I came into healthcare, I've sort of defined it as you are either the check chaser or the check writer. And to be on the check writing side of the table is a very different type of existence, where you are being constantly presented with options, ideas, widgets, and tools. And the problem is, number
Pat,
one,
how big is Bay State, just to give people perspective?
Bay State is a 4.5 hospital. We have an outpatient center, full delivery network with a primary medical center based in Springfield, Massachusetts, and providing coverage to the Western Massachusetts area. We have about 800,000 lives that we cover, and annual revenues of about $2.5 billion. So, decent sized organization, about 13,000 employees. Annual IT expenses, hover around in the $75 to $85 million a year, which is pretty much on par with any organization our size. What I see and what my peers see as IT directors is we'll see a lot of ideas get thrown at us. We'll get a lot of widgets thrown our way. We'll get a lot of sort of pot shots, if you will, in terms of, hey, we've got Nurse Call, we've got this, we've got that. What doesn't work for me is the, hey, I've got things, do you want them? What does work is the thoughtful approach of, we understand you have problems, we've worked with others, and do these problems resonate with you? Are you seeing the same type of issue? And how do you think our solution, which has been proven over here, could potentially, is that a fit for you? The one thing I think most often that I see is the lack of homework, where I just get, I'm getting blindly mass mailed by folks. I've had more interesting instances where people have, at least taken the time to look at my LinkedIn profile, and maybe they've found, where I went to college or where past experience was, and they've offered some sort of individualized connection, which at the very beginning shows me that they've done more than 95% of those that are doing the outreach in the first place, any cold calls or otherwise. But that doesn't necessarily that's not a successful gating factor. The way things tend to work is we are looking for solutions. We have problems, we're trying to get them solved. And right now, the biggest question is not one of, hey, I've got something, it's how can I help? That's the one that resonates most frequently. And the vendors that we have chosen to expand with or who we've brought on have come to us with through a couple of vehicles. Either we already had them and they opened up their portfolios and said, take what you need, we'll reconcile later. But Mike, going back to your point, the relationship factors and having built those established contacts gives us the trust and confidence to work with certain vendors to say, okay, we know that if we expand our portfolio and subsequently decide that this extended consumption of growth due to the crisis will need to be pared back down, but we'll be able to negotiate something that's viable for both sides. We kind of have three categories of things that we're dealing with right now in the COVID-19 realm. The first of which is exactly what I just described. Those things that we already had on board that we've expanded their use and growth out of necessity or other means. We have those that, and then we have those that we brought on board specifically to deal with surge and circumstance. And that's surge and circumstance. And these are things which we're using now, but then once the tide has gone back out, we expect to put back in a box and or throw away. And then we have a third category of things that we brought on in an attempt to deal with some of these issues that we found to not be viable or to be so much of a corner case as not to be sustainable, that we've basically just very quickly put on the junk heap, but we have yet to get rid of them. So we have unwinding to do. And those are three areas where we are, those are the three realms we're dealing with. Ultimately, what it comes down to is we are looking for help with Eric and I were talking this over previously, and the phrase that I threw out there is the cooperative development of solutions, right? We are not looking to engage in vendor and consumer relationships. We're looking to engage in partnerships. We're looking to engage in relationships. Healthcare systems run for decades, sometimes centuries. They have very long-term visions. So trying to hit an IT director with a, hey, I've got a quarterly deal, wrong approach, because he's looking at things that, what's it going to cost him in 5 or 10 years? So these are some of the approaches that we are taking in any conversation that we have. And in that same vein, coming to us with solutions, participating in solutions is critical. Providing me with a spot solution that is just one more widget that I have to support individually and discreetly, and have one subject matter expert that if they leave, we have no idea how to run a system going forward, doesn't help. They need to feed into our overall ecosystem. We need assistance in terms of not only what does your thing do to help us, but how does it then fit into the inherent complexity of our entire environment? Is that a fair representation? I mean, I think it's kind of difficult to articulate at times, but healthcare systems are insanely complex, as much due to their own machinations and belief that they are special as anything else. And we hyper customize things. One of the key areas that we can always use help in is how do we get to something more akin to an industry norm, and how does that apply to healthcare?
Guys, keep the questions coming. Q&A module back at the bottom of the screen. Like I said, if you want follow-ups to what Mike and Pat just said, I will try to get them into the conversation as quickly as I can. I want to talk now about changes we've seen or just innovative approaches that you've been exposed to recently, let's say over the past 5 years or less, that we think could be valuable to organizations communicating into healthcare today. So I'm going to bring in Jeff Green, our content marketing and social media guy. How, what are some innovative approaches, Jeff, you could suggest to the group?
Oh, Eric, first, I just want to react to something that Pat just said. And I can't believe how often, even as someone who sends those types of emails or as a recipient of those, how someone on the sales side could lose someone in the first few words. But I see it all the time too, Pat, and it's a different approach needs to be taken. Let's provide solutions. Eric, to your question about tactics that I've seen and used over, say, the last 5 years, to me, one of the most underutilized vehicles is video. And yes, we see it used frequently and all the time, and the younger crowd is all over YouTube and Snapchat and TikTok, but that's how we're all consuming content these days. And I can give you an example of a way we used video at Zipcar. So I headed up social media for that company. It's a car sharing company for those who don't know. And although my role was for the most part B2C, I think it's something that could apply to this audience as well. So we decided to conduct a video contest, and we were looking for Zipcar members to submit videos as part of a contest, and the winner would ultimately receive what we called the ultimate zip trip. So it was valued at about $5,000, a trip for two to just about anywhere the winner and that person's partner wanted to go. We ended up, so we asked for short videos to be submitted. In this case, we did it on Facebook, but you could really do it on any type of page or website or social channel. But we asked our members to submit short videos. I believe they were 90 seconds or less. We ended up getting about 10,000 entries. And out of that 10,000, I'd say there were probably 1,000 of those were quite decent and of good quality to the level that we would be very proud and pleased to share them with the larger audience. So then we whittled those 1,000 videos down to the top 100. We selected a panel of judges, and they voted for the top 3 videos. And from there, we let the public vote for the winning video. And that is, to me, a terrific way to, we spent, I'd say, a small amount of money. Let's call it a few $1,000s to create this contest, but we got 1,000 entries, and this is user-generated content that is it's priceless, because you can use that in an email to your contact list, via social media, on your website. So to have to provide a path for that community to submit videos, and in the end, we were the recipients of just hours of great content. And if it makes sense, putting on my population health hat, I can tell you that I can see how that something like that would work for this type of audience. Like let's take an illness or a disease such as diabetes. So there are, in the US, approximately 30 million have diabetes, and the vast majority of those have type 2 diabetes. So I could see this as a great way to get patients as well as their caregivers to submit videos. And maybe it's they provide life hacks. How are they dealing with diabetes, and how are they winning? Diabetics many suffer from obesity or even depression, or different types of things like that. And this could be a good way for people to submit, this is my life hack of a diet or an exercise program, or this is what I make for low sugar recipes. And by bringing these people together, you sort of foster a sense of community and you inspire others. And it could even be about how they adhere to medication. But it's another example of how a contest making use of video could apply to the population health type of crowd.
What about from your perspective, Mike? I know where you're actually working to get clients closer to their clients. What are some changes you've seen? What are some approaches that may work today?
Yeah, I mean, I really want to echo something Jeff just said on user-generated content. That's actually a tool that we've been using, in patient insights for years. It used to be when, one of my clients wanted to get closer to, the people who take their drugs, right? We'd have to, either run focus groups or go into their homes. And a lot of times you'd want to go into their home just to get a sense of how they live, to build a sense of empathy for that person. I mean, I'm someone who believes that, empathy leads to breakthrough creative. But this day and age, no one's inviting anyone into their homes to do research studies, nor should they, right? So we've been using mobile diaries as a tool to get those same insights. We'll task people to, document, do a day in the life, a photo day in the life, or a video day in the life using a specific a mobile phone app. And then we're able to kind of understand what it means to be them, if you will. Now, pre-COVID-19, there was a ton of resistance to doing something like that because, for lack of a better term, a lot of market researchers, specifically on the pharmaceutical side of things, are kind of still stuck in the dark ages. I mean, not to be judgmental, but I will be, to the point where, even doing Zoom interviews like we're doing here, with people instead of traditional one-on-one interviews, there's a lot of resistance. And I get the resistance. The resistance comes from a place of, people might be distracted, particularly when we do this type of work with physicians. Not that we give them mobile diaries, but we can do a fair number of one-on-one interviews with physicians. A lot of my clients would be resistant pre-COVID-19 to say, well, this physician's going to get distracted if they're doing it from their office, which is 100% true. They do get distracted. Recently I did a study with talking to a certain segment of physicians, and there's one participant, they were getting bothered it seemed like every 5 minutes, and we're trying to go through a drug detail aid to get some feedback on it. And but what was interesting to me in that specific situation was that my client turned to me online virtually and said, we wouldn't have seen that if we did this in an interview facility, which is where that work typically happens. So, which is true. You get a little bit more real life when you can get actually into the office. Now, I suspect other people here can relate, right? I mean, if my clients who are often, charged with, having face-to-face meetings with heavy prescribers, kind of know this pain. They can't get into that office now to do that. So, I guess the lesson I have here is, how do you use, tools like this and other interactive tools to kind of do the same and engage healthcare leaders? But Eric, it strikes me that, I mean, you're someone who who does stuff like this with healthcare leaders all the time, right?
Yeah, we do. You know, one of the things that has, you know, our business has not been impacted a whole lot because we do a lot of virtual stuff, but we actually do a lot of dinner meetings where we take executives at healthcare leaders and put them in the same room and have a 15 to 20 person discussion around a topic of shared interest where idea generation is a value. And the actually that dinner format really works well via virtual platforms, of course, without the booze and the food costs. And we get hired to do these not just to moderate, but the promotion from a third party often diffuses some of the commercial stressors that let's say a healthcare vendor would have if they were trying to invite folks to their own dinner. And what we do, similar to what you do, Mike, is we'll bring a targeted dinner list of VIPs at let's say a payer or provider segment together. And if we do this now virtually, we'll get like, let's say 15 healthcare leaders, maybe with one or two representatives from my sponsor there. So think of it as a group of 16 to 18 with my team included to moderate. Now, 18 is probably an okay number to moderate around a live dinner table. Virtually, that becomes a little bit difficult. A size like this that we're having right now is probably more easy to manage. So what we'll do is we'll break people into side tables, and imagine having 3 dinner tables of, you know, 5, 5, and 5 all in parallel. And we could do that, let's say, using Zoom meetings, if you're familiar with how that works. Many of you probably are. And we have prearranged questions, and we'll usually at the halfway mark reshuffle the deck so the guests get to meet almost everyone else at the dinner table, because the value for them is really to meet peers, and you know the value for the sponsor is to meet everyone as well. So those can be done fairly easily using Zoom, for instance, and some other conference call platforms where you could sort of take a combination of the dinner meeting approach that Shared Purpose Connect does with the Vertigo approach, and be able to bring people together in a unique way during this time. And it's not terribly ineffective even during normal times. But Mike, how do you go, you know, from using that format to get to the next level with your relationship with your clients?
You know, I don't know that it's that format specifically, Eric, but I will tell you, part of the answer is also in something Jeff alluded to earlier, which is really the power of video. So much of what I do, I mean, at the end of any engagement I have with a client, I have to prepare some kind of summary of findings, right? Tell them what we learned, how we learned it, and what it means for them. And I mean, 9 times out of 10, that's what is expected is a PowerPoint document. But you know, I mean, we've all seen PowerPoint documents, and they're not the most emotional things in the world. But so much of what I do is trying to tell an emotional story. I mean, that's one of the taglines it is a tagline for my company. It's find the narrative, share the story. Video is becoming the primary way that I'm actually sharing and socializing insights with clients. And so to me, the answer to your question is going above and beyond what is expected. The way I go above and beyond what is expected is going beyond written reports to mini documentary style films based on the themes that we're uncovering in research. I did a project a few years ago, and this is kind of what I had this insight. Doing a project a few years ago for a health insurance provider. This was right before healthcare reform was going into effect, and they were, you know, now having to sell to a bunch of people who they've never had a market to before. You know, they were now having to target uninsured Americans. So they asked us to understand that market for them a little bit better. So we did a very deep dive into the lives and realities of uninsured Americans. And the light bulb went off in my head as we were kind of pulling the findings together that, you know, a written report was not going to get it done, specifically because we knew that we needed to help this insurer build empathy for this target, because the people who we were interviewing couldn't be any less than, you know, any less similar to the people who we were presenting these results to. So I had the idea of creating a documentary film deliverable, which we played, you know, as we went through our report to the senior executives at this company. And it actually brought tears to some people's eyes, because the insights were actually very powerful. We wouldn't have gotten that if if we didn't have a video approach. So the takeaway here is that, what we've done is use storytelling as a way to grow those relationships. And then, we found a way to provide value to an engagement. For us, that's through video. For other people, in this webinar, that could be something else. But, in the age of master classes and YouTube tutorials on just about everything, there's definitely an inexpensive way for you to do that in your own organizations. If it's video or if it's something else.
That is a great idea. I mean, you're doing the work anyway. You put in a little bit of extra effort, you over deliver and surprise the client. And video is clearly a powerful tool. Because it's now, you kind of teed me up very quickly for a quick little commercial. On Tuesday, May 12th, folks, at 11:30 a.m., I'll be having a live conversation around how to leverage storytelling and video in healthcare with an expert by the name of Todd Hartley. Todd's group works with large organizations in healthcare and pharmaceuticals on video storytelling. So works with all kinds of cool people like Tony Robbins on just training leaders on how to best use video to drive behavioral change. So I just think you've heard it a couple of times from our group. If you go to our website, sharepurposeconnect.com, and click on Executive Roundtables, you could register for that. It's free, of course, for the group. And if you want to, we'll have an opportunity during our feedback forum, that should be coming to you in about 10 minutes. If you want to reach out to Mike and see sort of how he's doing it to further over deliver for his clients, there'll be a button you could click and connect yourself with Mike, or I'll introduce you to Mike so you could get pick his brain on things like that. So let's Pat, I want to bring you in one more time. And how are your vendor partners, for lack of a better way of saying it, how are they over delivering or taking it to the next step with Bay State Health during the crisis?
So let me open by saying that the ones that have sort of been summarily dismissed are the ones who have come forward with, hey, we've got lots of stuff. The ones that have been engaged most readily are, again, as I kind of mentioned before, those that we already had established relationships with, who very quickly and proactively came forward with, how can we help? What can we do? And additionally said, again, opened their portfolios, opened their vaults and said, take what you need. We'll talk about it later. That has resonated in a sense that there was a true communal intention, and goodwill was embedded in whatever these offers were, or whatever the approaches were. And we've subsequently gone back several times with, well, what about this? Or we have this need. And again, it's all built upon these pre-existing relationships. And many of those relationships have been strengthened because we've asked questions. And in some cases, it's features or modules that we hadn't previously purchased, or features or modules we weren't previously aware of. In many cases, it's actually been vendors going, I hadn't thought about that. What if we did? And then helping us to evolve in real time, experiment and provide solutions. I think, when you're in a crucible like this, the willingness to experiment rises quickly when you're trying to address urgent and immediate needs. We've had examples where, the practicality of the safety, the PPE issue being what it is, we needed to intubate patients. And our own innovation center, we have a group called TechSpring, which is wholly focused on the development of new technologies or bringing technologies from other sectors and markets that could be applicable to healthcare into the healthcare environment. Worked with 3D printers to develop snorkel masks. 3D printed snorkel masks fully encapsulate an intubator's face so that they are fully protected. They plug into air coming out of the wall, so that they don't have to worry about whether or not, if they get coughed on or sneezed on or whatever during the course of putting a tube down a patient's throat, they have safety and security knowing that they can do their job, effectively. It's basically a hybrid, level of PPE, but it was needed and built and designed urgently and printed and deployed. And we had assistance with, members of our community, both internal and external to the facility, that came up with that solution. And now it's something that we've taken that and we said, okay, where else can this apply? Not necessarily 3D printing, but that quick iteration, and how do we evolve, and who can we work with that is going to be able to rapidly iterate with us. In some cases, it very much has been things that have been offered to us saying, hey, listen, take it, tell me if it works. If it doesn't, let us know. If it does, we need to tweak, change it, whatever, we'll do it. So that level of cooperation has been, those have been the partners that we have found the most value in. And I think the lack of a sales pitch and more of just a human connection, which that's what healthcare, believe it or not, really still remains predicated on. They firmly believe that relationships and personal interactions and seeking to do the right thing matters. And if you can put something to that that has value, you're going to get, health systems will subscribe.
Folks, as you bring in your questions, I'm seeing a few of them come through the queue. If you have a specific panelist that you are following up with or want their perspective, please note it. If I don't see that, then I'll assume you're just looking for me to lob it up to the entire panel.
Again, hey, Eric, can I just throw, I'm sorry, can I throw one more out there?
Yeah, go ahead.
And I neglected this. One vendor that I'll talk to right now is Cisco, and in particular WebEx. For those of you that have worked with health systems, you know that meetings, you would think that that's actually how health systems are run, is in meetings. They are frequent, they are long, there are many. All of a sudden, we needed to put more than 4,000 of our staff into remote work environments. And a lot of them are, administrative, et cetera. Still needed to be able to collaborate, to work together, to have the meetings that had been so essential. WebEx basically said, go, take as many licenses as you want, get set up. And we deployed the better part of 1,000 WebEx rooms to individuals over the course of 72 hours, which then took away this massive concern as to how are people going to stay connected and what are they going to be able to do. And it was just something that they did. They said, we know you're going to need it. They had an understanding of our dynamic, they had an understanding of the industry dynamic, and they opened the floodgates because they knew that in that moment, that was going to be one of the most critical and essential needs, was that ability to communicate and collaborate. That has quite honestly cemented Cisco as a telephony and communications provider within our system. That act alone.
Wow. Cool. That's props to Cisco there. I'm going to shift gears a little bit because I know a lot of the folks in the audience leverage direct marketing, specifically email marketing, to drive communications, whether it be B2B or whether it be patient engagement or the like. So I'm going to bring in John Stock. John, and for those of you joining us late, John's the former CEO of World Healthcare Congress, who does a lot of marketing of their events via direct marketing, email marketing. He also works with a lot of big companies on B2B strategy using their database. How, John, should folks leverage their database of customers and prospects and suspects, whatever we want to call them, to drive innovation and drive new business in today's climate?
Well, Eric, first of all, thank you for the opportunity. And I think Jeff and Mike did a great job touching upon this when they were going through what they've done. And Patrick hit upon it as well as a really kind of the end user. But really what I've done with my recent clients, it's really about taking more of a narrow approach versus the whole market to the whole world approach. And one of my recent clients was a on-site vision provider, and we focused just on 3 states and really kind of within a 3-city-mile radius. And we really kind of went out with targeting HR and benefit executives, but we really focused on employee engagement. We really kind of went in and we interviewed some of the executives to understand what was keeping them up at night with employee engagement and how our solution could potentially help them. And that's how we kind of geared our marketing and focused it, really kind of drilled down. And we continue to do that even now with another client who's actually launched a product in 2019 for infectious disease. So obviously, it's really a kind of an interesting time to launch a COVID-19 product. And we're very careful, but we're kind of going out again with, Patrick had kind of touched upon this as well, with the approach of, where it's actually being beta tested at a medical center in Texas. And so we're saying, hey, this is working for them. This is what they're saying. This is what they're doing. Can this potentially help you out down the road? You want to test it out and try it. So for disease audits. So it's something that's being very specific, very targeted with anything at this point, with the database, with the marketing, and then really looking at your feedback, looking at your clicks, looking at your opens, and trying to gather as much insight and analysis on the data and the responses that you can is really kind of a key. You don't have to spend a lot of money nowadays. And I think that I'm kind of recommending to all of my clients right now, it's more bottom funnel marketing. So it's more webinars, it's more higher touch points where you're giving away content, you're showing them solutions to help out where you potentially can. And Mike touched upon this. I'm actually in the process of working with one client on launching a certification program for one of their products, or it's going to be a free certification, but people will be able to come in and learn and be certified. And it's kind of a nice thing to do. And I think one of the things that I've learned being at home is I've done some certifications recently. So, and I think other people, corporations, hopefully will kind of look at this as well. So it's a good test pilot for them and a good way to get the content out.
Let's start. What are some tactics, additional tactics that the group believes can be effective in the current business climate, whether it be tried and true things that need to be used more often, maybe a brand new idea, or even a tried and true tactic that needs to be adjusted a little bit for the current business climate? I'm going to start with Jeff on that, and then I'll move over to John on that next. Go ahead, Jeff.
Yeah, sure. In our efforts to get in touch with our contact base or customers or prospects, in my world, we have social media, we have email newsletters, we have our website, which has really become the main gateway to the company, especially for those vendors who relied on, say, trade shows or other types of in-person tactics to meet with prospects. But with social media, newsletters, websites, to me, it all revolves around content. And if you don't have a strong piece or pieces of content, then it's pretty much a waste of time to be using those channels. But I also believe that the best content is not selling your product. It's more about providing value. So in what I've done for a number of technology companies on the B2B side is and this is a switch over from what we were just discussing earlier, Mike, about video. Now I'm going to speak about white papers a bit. So again, without branding a white paper, but providing value, I've been involved in the past in creating the white papers that might be about, say, 7 factors when considering deploying XYZ type of technology in your organization, or 5 reasons why it's important to consider this type of technology. And so I believe when a white paper is done right, it ends up allowing you to generate and to nurture leads. And that's where the win is. The win is you're providing value and help. You're informing the reader, and on your end, you're increasing your contact list and your list of leads. And so, Eric, I can go into a little bit about how we create these and how we put them out there, and if that's if you feel that'd be valuable.
Yeah, I think it's important because obviously most folks in the room have either consumed or produced a white paper or done both. It'd be interesting to hear your take on what makes this approach slightly different and maybe more effective than a lot of other other competing tactics.
Yeah, and keep in mind that the videos we were talking about earlier are nice, quick, and easy ways to get in touch and to educate. A white paper goes into a bit more detail. I don't feel that it has to be copy or copy heavy, but a good title will draw someone in, and studies have shown that a number in the title allows you to communicate with the reader, the person who's downloading this white paper, so that they know specifically what they're going to be getting within that document.
So what do you mean? Like something like 5 reasons why you need to think about virtual care or something like that?
Exactly. And then you deliver on that in the content. And if you don't provide that within the content, then you're wasting the reader's time. But yes, a title like that catches someone's eye and draws them in and tells them exactly what they're going to be getting. So title is key. The content itself, I believe it shouldn't be too lengthy, like with the 5 reasons or the 7 tactics. It can be in the form of bullets and images and graphics and tables. Plenty of white space. The end goal is to have a call to action where where someone who's reading it says, yes, I'd like to learn more about that. And just a little more specifically about the content, when I said earlier that it in my opinion, it shouldn't be branded and you shouldn't be selling your own product. Instead, you are providing a window into the category of, in this case, that technology. So there might be plenty of competitors, but you're giving the reader reasons to, or information on how to evaluate the marketplace. And that can really arm or provide the reader with the right ammunition, because likely she or he needs to sell the idea into his or her organization. So to be able to arm the reader with that information it's to me what it's all about. It's educational and it's informative, and you're gaining the trust of the reader at the same time.
Got it. So has to be eye catchy, but then you have to deliver, keep it sort of, I don't know, USA Today like level of reading and graphics, and provide true value. So non-branded usually. Yeah,
non-branded. You know, of course, everything needs a little bit of branding, but you're not selling your product, and you're keeping your brand and your call to action at the very end.
Okay, that's awesome. Hey, keep the questions coming in. I want to follow up on this question with John. Patrick, there are 2 questions in the Q&A module that are specific to you and fairly technical. My thinking is you could answer those through the module directly to those attendees if you can. So, John, what are some additional thoughts, like how to maintain or even increase commercial operations and staying cost effective, during this sort of unique once in a lifetime crisis?
I mean, I would look for and focus on channel partnerships as well. I think that, so really when you understand your customer persona, looking for other clients, whether it's technology companies, whether it's, so I'm coming from recently out of the selling to the HR and benefits space. So we would partner with brokers and really kind of form as many partnerships as we could with brokers was one of the recommendations I had given to the company and to the client. And they were very successful with that. They were able to utilize the broker relationships and into their clients, and they were able to get into UPS, Home Depot. And so looking for potential partnerships where you don't necessarily need to revenue share, or you don't necessarily need to have a full-on contract, but looking for those where there's likes, interest, and you're trying to get into these clients, and then sharing clients, sharing prospect and databases. We did a lot of that as well, and a lot of testing that way with some recent clients. And that seems to have worked, because it's validating you in another way, and it's validating your technology or your solution in a way that was somebody that the client that you want to get into is already working with.
That's great. So what about, did you do anything with your World Congress hat on virtually? I know obviously there's a couple of big signature events, but you guys did webinars as well, right?
Yes, I mean, with the World Congress hat on, it's been almost 2 years, but one of the things that we were predominantly direct mail, direct email, inside sales, so that we weren't very client facing until we got on site at the conferences. So there, we did do a lot of webinars, and I would recommend, and I think everybody in the panel has talked about that, utilizing the webinars, utilizing the white papers, as Jeff just said, are a great way to continue to keep your brand in front of people without selling your brand is another. So Jeff's solutions there are spot on.
Yeah, I mean, if I could just pontificate on that, obviously it's near and dear to my heart. I like John, used to, in a few past lives ago, used to work for a conference company, and as a on the other side of the camp, have attended a lot of conferences, whether my organization was sponsoring or not. And often the money invested in some of these large events goes wasted, and the plan's not in place. And exhibit booths are typically, you're just looking for a diamond in the rough, maybe someone to stop by. I think virtual events were being underutilized then, and now with a lot of folks experimenting with them, I think it's really important to be careful about how your organization can cut above all the noise and provide some true value virtually, and be able to communicate with the market in a way that they feel that you're going to provide them value, and it's not going to be a timeshare scam by blocking their calendar for that hour. I think that's really important. So I think you should consider using virtual events as your hub and spoke to your marketing and lead generation strategy to begin with. You could take an event like this and then use the sound bites from it and notes from it and findings from it as part of your blog, video clips on your website, etc. And then you have the live event itself, which could generate all kinds of new relationships. I also think that you need to, I'm a big believer in the panel format, as you guys all know, because if you bring in the primary market to share ideas, it diffuses the risk to the potential attendee that it's going to be a sales presentation, that they're going to hear from their peers about how they're dealing with the same problems they are. And in so much that you put yourself in that conversation in a very productive way only heightens your subject matter expertise, your status, and the likelihood that someone's going to want to approach you to work with you in a commercial way, which is of course your goal there, to drive leads and get meetings from it. So I'm a big believer in it. I'm of course biased. I think you should use a third party like Share Purpose Connect to produce them and market them and help organize them. But you could certainly do them on your own. You just have to be cognizant of how you produce it so you're truly delivering value and diffusing the risk of it feeling like a sales pitch that would limit your attendance for sure. Let me move on here. We have 10 minutes. Patrick, how are you? And I know you're typing in some answers to folks, but I want to bring you back in and talk about how you are, as an IT leader at a busy health system, engaging in content today. Like what are you doing? What's attracting you to engaging in content, whether it be a webinar, a roundtable, a white paper, a blog, etc.?
So I think the first thing that, and I can speak for my peers on this, we are inundated and exceptionally busy. So the time and opportunity to be able to do research or be able to engage is fairly limited. So it needs to be fairly eye-catching, right? And it needs to align with the things that I know to be the problems or the issues that we're dealing with. One of the biggest ones that within INT that we're focusing in on right now, and we're doing so even before COVID, is unified communications and the ability to collaborate from, not just in a conference room, but from afar, and to do so effectively. So that's where things like WebEx have come into play. We are rapidly experimenting with Microsoft Teams, document collaboration, other such things, trying to get asynchronous in terms of how work is done and being able to, right now, I'll give you an example. As soon as we're done here, I got to go down and feed my kids lunch. So the odds of me being able to attend a meeting on a regular basis at noontime is pretty slim, but many of my peers who are empty nesters can do so. But if they can work through a document or iterate while I'm making a peanut butter sandwich and handing it over, and then I can step back in, see their notes and comments, etc., that's a great thing that we can ping in on. Additionally, we do share and collaborate. So we've done a lot of grabbing ideas that catch our eye, and we share them. So whether it's on LinkedIn, Twitter, social media, admittedly, some probably not too appropriate memes just to help us get through what's going on. But the nature of what hits is the things that make the most impact are those that correlate to our needs and objectives. So we are within a health system, we are constantly seeking to become operationally efficient. We are constantly struggling with how to stay connected, not just to our own personnel, but our patients. These are key and important themes. And at the same time, we have massive investments in platforms and systems such that to come in and say, hey, I've got this thing, if it doesn't plug into everything else, I can't use it. it's not going to be effective, because then I'm going to have to do something like a flat file data transfer, or I'm going to have to fax, God forbid, yes, fax documents back and forth to be scanned in. That still happens in healthcare. It sucks. It doesn't work. So if you're going to seek to present a solution or an option, make sure you have connection points and make sure you can articulate them and their value, and do your homework in terms of what are the core platforms within a health system. Microsoft is a major player. Cisco is a major player. Dell and others. Look at the platforms, the solutions. Do you connect to Cerner? Do you connect to Epic? Make sure that you are able, whatever information or that you're generating, healthcare is very data driven. It can be consumed by secondary, tertiary platforms and utilized for operational decision making. Those are key things that we are looking for. One of the examples that we had, and this is a constant question, how did our partners, the ones we work with, how do we know what's going on? Well, we conducted a reverse vendor fair. We invited all of our core players that we work with, our core partners, and several others that were very interested. We had an event at our innovation center where myself and the other IT directors presented our roadmaps. And we basically put up on the screen and said, here's what I'm doing. Here's where I want to go. Now, don't come back and pitch me on how you plug in. You are all sitting, and we're now looking at this room full of, at times competitors, saying to them, you guys get together and collaborate and figure out how to meet my need, and that's going to get my attention. So those are the types of aspects that I think are the most impactful, are those that listen, those that are able to, that can demonstrate they have an understanding of the healthcare space, and in particularly nuanced, particularly, if you have a very specific tool or technology, make sure you're getting to the right person. Right? I do services. My crew does a lot of the break fix. I don't touch the EHR on a regular basis, other than to make sure the computers that support it work. But I still get solicited all the time with, hey, we've got Cerner staff available. Doesn't mean anything to me. Gets readily ignored and gets dumped away. So make sure that you're targeting appropriately and that you are paying attention to titles, whether they're on LinkedIn, on business cards, or email addresses.
Yeah, so that's a great point. And there's a couple of questions coming in around impact and ROI. So quick programming alert. One, your surveys are in your inbox. Please take them. That will avoid me bothering you any further. I have the ability to clog your inbox. I think I've proven that. So thank you in advance. We're going to go a little bit long because I want to get to the ROI questions and see if we could address those for everyone. So apologize for going a little bit long today. John, how would you advise to measure sort of the impact of your tactics and the content that are being produced? We had a lot of good suggestions that have been put on the table today by the group. How would you measure that and manage the pipeline in a way that's super effective?
So I would really recommend managing it by looking at your bottom funnel contacts that are coming in. I mean, obviously with the white papers and some of the webinars, they're going to be.
Hey, could you clarify top funnel, bottom funnel?
Sure. So, I mean, top funnel is often the clients that are just coming into, not even clients, but downloads of white papers or thought leadership pieces that really may or may not be interested in your services, but hey, they like the content that you put out there. Really my focus has always been when I'm working with clients is top funnel is nice, but we really want to get to the bottom funnel, which are those that are coming in, expressing an interest, contacting you through your contact form, saying, hey, reach out to me. And so a lot of the marketing that I focus on and try to do is around that bottom funnel so that we can then get them into the sales pipeline for the sales team or the BDR team to run with and to really kind of create that engagement. But, I would really kind of measure on that bottom funnel. And when I went to one of the recent clients, they had a lot of top funnel leads, but nothing was being pushed through and nothing was working. So we did a complete shift of their marketing strategy, cut back the marketing spend quite substantially, and really focused on driving leads to a contact form to really kind of understand who was interested in the database, who was interested in their action of the database, but interested in their service. And then we saw really an uptick in close rates, which obviously engaged the sales team, engaged the company, and it kind of got them to kind of make a nice leap forward.
Quick, Jeff, I'm going to bring you into this because a couple of people have asked about measuring ROI on the white paper. So I want to see if you could take us through that. Folks, if you want to reach any of our panelists just to pick their brain, network, etc., you could contact me. You have my email, but they're all on LinkedIn. And if you take the feedback form, and you'll have an opportunity to be introduced to them as well. And I'll just send an email and connect the two of you. So, well, or three of you, whoever you want to meet. So just know we'll be able, these folks are all willing to kind of talk to you guys offline. And this session is being recorded. We'll put it up on YouTube and we'll put it up on our website. We'll let you know when that's all live. Jeff, take us through how, let's say for your white paper example, how you're measuring the impact that a document like that is making and contributing to, let's say, John's bottom funnel.
Yeah, sure. And to John's point, plenty of people might be downloading white papers, and it doesn't necessarily mean they're a qualified lead, but just to get them in the door. And as an example, I'd say one of the white papers that I've created, well, they usually live on a landing page, or that's one way to access it. So the white paper is behind a gate. The gate is what's known as the contact form. So the contact form typically, in my experience, is first name, last name, company, and location. And so by downloading the contact form, that information then goes into Salesforce. So we have the contact or the lead there. So great, we have a new contact from that. And then from there, depending on and also I'd say one other field on the contact form might be company name. So, to know that this is the type of company and this is the type of person that sales should be dealing with, then they can further vet and determine whether or not that's a sales qualified lead. But the way we measure ROI is, so if I have that white paper on a landing page, I'm closely looking at the analytics and the metrics that are involved, such as number of visits to the white page, to the landing page rather, and how many people are coming to that page and are downloading the white paper, how many people are coming but not downloading it, not filling out the form. So because that's very informative also. If you have people visiting a landing page but not taking the time to fill out the form, then it informs you enough to make changes to that. And to give a further or a little more detailed example. So if I have a contact list of say 3,000 people and I email out some information about this white paper and how it could be of value, if you're exploring these types of solutions, then take a look at this white paper. So I look at open rate on the email, click-throughs to the landing page, number of downloads, and then depending on where we house the white paper, it could be on a platform. One example is a platform called DocSend. So white paper is hosted there, and DocSend gives you the analytics of how long did someone spend on each page and what page did they spend the most time on. So it's really interesting information that you could use to pass on to marketing. And just back to that number of 3,000, I'd say in the case that I'm thinking of, one of the technology customers or clients that I've worked with, the 3-year sort of revenue from one customer, it would be say approximately $80,000. And so if we divide that by 3, I believe that comes out to about $26,000. So just one sale, by creating a white paper and putting it on a landing page and maybe using a developer and maybe a little bit of legal's time to make sure everything is kosher, a designer, say that white paper might have come to a grand total of $3,000 or $4,000. So a $4,000 investment in order to yield a revenue of $80,000 over 3 years, it's really a no-brainer. So just one sale, but you're hoping for much better results than one sale, but one sale can cover it and then some.
Yeah, that's Got it. If you, could people reach out and try to get sort of that equation that you just laid out? There
Yeah,
was
I'd
a
be
lot of
happy
math.
to provide it and to speak further about it.
Okay. Guys, I think what I'm going to do, 5 past, I'm typically pretty good at ending on time. So I want to close things up. I want to thank everyone who's taken the time to attend today. Again, this is being recorded. You can check it out, the recording on Bright Spots and Healthcare podcast. We'll have it on our YouTube page, and which we'll tweet out. And we also have it on our website, sharedpurposeconnect.com. To our panel, thanks so much for all the prep work, all the time today, all the insights, really informative. So thank you very much to all of you. Really appreciate it. Folks, please take the feedback form, and I'm happy to connect anyone on today's call with whoever you want. That's what these things in large part are all about, is to connect folks. So thank you very much. This marks the end of the call. We'll see you on May 12th for our next session, a live conversation around the power of video and storytelling in healthcare. Really appreciate all your support, everyone. Stay safe out there. Take care.
Bye, everybody.